Namaskar. We would like to welcome you all on behalf of Independent Research Ethics Society, and the milestone is 2277 of our project AYUSH SAMRIDDHI International Webinar Series. We are really grateful to respected Mohsin Bhai, who has blessed us as guide, pillar, mentor from last so many years, right from the starting of this journey. So I am grateful to all members of World Unani Foundation. I would like to congratulate you all on Eid, though it is late, belated. Congratulations, but देर आयत दुरुस्त आयत. मैं सभी वक्ताओं का हार्दिक स्वागत करता हूं, शुक्रिया अदा करता हूं और मोहसिन भाई से प्रार्थना करता हूं कि वो अब मंच की घर के मालिक की तरह संभाले, और वो हमारे पिलर हैं, आयुष समृद्धि के एक आधार स्तंभ है मोहसिन भाई. मतलब मैं सलाम करता हूं उनको, नमन करता हूं उनको. उनकी जो कोऑर्डिनेशन पावर है, विद इन वन डे वो मजमा पूरा शानदार और शाही हो जाता है. एक्सीलेंट मोहसिन भाई.
Thank you, Sharma ji. Uh, the words that you have said, thank you very much. But it's all because of the support I get from all the speakers, all my friends from all over the world. They are also very helpful that they also are ready to come to this webinar on just one single message or one single call. So I thank you all for joining us at this webinar. I Let me first congratulate Dr. Pavanji for 2,200 plus webinars and the world record that he holds in the Guinness Book of World Record that he holds for the maximum number of webinars uh, held. And I want to congratulate all of you. I wish you all a belated happy Eid Mubarak. And though it is late, but because most of us were on holidays, that is why we are having this webinar after a few days. So let me start now. I welcome you all. The topic is Eid celebration, navigating life after Eid. Normally, we have spent 30 days of fasting, uh, 29 or 30 days, whatever. And after the Ramzan's end, we tend to overeat or we tend to party. So this is basically a webinar that we want to show that we should constrain ourselves. We should continue what we've been doing for the last 30 years, try and adopt a healthy lifestyle. Uh, I've I managed to lose about 2 kilos, and I don't want to put it back again after the Ramzan ends. So definitely we all should control ourselves and remember that 30 days we have prayed a lot. We should continue the same routine of getting up at Fajr in the morning, praying 5 times a day. Normally, we see that after Ramzan, the masjids, the mosques become empty. So I think which is wrong. We should continue the practice that we've done all these 30 days. So now let me start the webinar. Unfortunately, first, Mr. Hamid Ahmed, the CEO of Hamdard, I just got a message from him that he's got a very bad sore throat and a cold since last night, and he won't be able to join us. So now I'll request Professor Idris Saab. Uh, he's the former principal and Dean ANU Tibia College. He's also been very, very active in Unani, and he's just a call away from me. And whenever I ask him to join, he's ever ready to do anything for Unani. Thank you very much, sir. Your floor is yours.
Thank you, Mohsin Sahib, Dr. Pawan Sharma ji, and all distinguished panelists, resource persons, and audience across the border. So let me first say salam and congratulations on celebrations of Eid. It is still going on. I must congratulate Dr. Pavanji, who gives up this very significant platform.
Thank you, sir. Thank you, sir.
He is now one of the persons, not only in India, but I think uh, in the world, by making so much seminars, webinar, webinar, to more than 2,000. I think this is the 2,277th, if I'm correct. So that Mohsin Delvi Saab introduction by Pavanji, he is very popular, not popular, but as his name suggests, Pavanji, his name is Mohsin. Mohsin means the, in Arabic language, beloved. So we all, be it Unani fraternity or Ayurveda, AYUSH, and even he is very much popular in allopathy arts, in drug manufacturing side or teaching, and all people love him. So you have got this person very lucky. You are very lucky. So let me come to the theme of this webinar. The theme is very important. We have already gone through this protocol of being Ramzan of 30 days. Uh, it is, though it is a religious commandment uh, to all Muslim Ummah, but it has another aspect that is very important. Religious point of view, it is relates to the spirituality, but from medical point of view, it's a very healthy protocol once in a year. We can compare it with the latest fad among the new generation. We call it the intermittent fasting, in which the fast occurs very important, very importance. A study was published on the next day of Eid, that is the 1st April, in the very reputed journal, Annals of Internal Medicine. The study was a randomized clinical trial on the effect of intermittent fasting on weight loss at 12 months, 4 is to 3. That is the once in a week, only 3 days, not consecutively, but alternate day. We should observe the intermittent fasting, having some restriction on calories, and the rest of 4 days in a week, we should take as our calories as usual. So after 1 year, two groups were studied. So the group or intermittent fasting, they have lost very significant weight. So the outcome of this study was published in that journal. You can access this study; it is available. So this is the very fraction of the intermittent fasting in comparison to continuous 30 days or 29 days of rosas or fast, in which on an average 12 to 14, or even some countries it goes to 16 or 17 hours of rigorous fasting. Just depend upon air. No food, no water, no nothing except air. So this is very rigorous uh, sort of protocol, and We can, since we are all the doctors, सारे लोग learned expert हैं यूनानी के मेरे अलावा, so we know the autophagy, which was given the due recognition by giving the Nobel Prize in 2016. A gentleman, a researcher from the Japan, who had studies regarding the effects of fasting. In our biomedical terms, we call it the autophagy. And the autophagy is nothing but the cells, eat cells. This is the simple principle behind this autophagy phenomenon. So during the fasting, our body not only toxify but also regenerate. In the sense, it mitigates all the morbid substance and increase the immunity power. This is most important. In our system of medicine in Unani, there is a clear-cut concept of having the fasting as a medical intervention, right from the Bokra, Hippocrates, Galen, and Ibn Sina, Dolazis. They all have mentioned the benefits of fasting. Even in Ayurveda, Langhan Chikitsa is very important component of the intervention. So, in that sense, fasting has not only the spiritual component, but is also having medical importance also. Spiritual or some dignified religious form, we can understand by the way of when something is uh, very useful to a common person, so we give it a divine template. Uh, for example, we have a number of plants, we have a lot of activities there. They have mentioned in our Holy Quran or Bible or Gita or Ramayana, not due to their religious aspect, but due to their versatile properties. So likewise, the rosas for a layman person, though it has some religious importance or spiritual aspect, but as a medical scientist, uh, we can understand its importance in biomedical point of view. Eid and after, as told by the Mohsin Sahib, this is very important. We should aware the general mass that we should continue this protocol not only by having the fast for the whole of the year, that is not possible, but the regimen we have observed during the month of fast fasting, we should take the maximum fruits and vegetables and minimize non-veg. To all the non-veg is prepared in the oil or fat. So, being in Ramzan, we break our fast with the dates and waters and a lot of fruits. So, this type of habit we should maintain after this month of Ramzan, that is the rest of 11 months, so that we can maintain not only our weight but improve our immunity. That is very important nowadays. So, in that sense, this message should be percolated down to a general layman public. This is though this is a religious duty, but this is not restricted to the religion, but it also uh, relates to your health. So, the benefits you have accrued during the month of Ramadan, uh, it should not be lost in ensuing month during the 11th month. This is the main message should go to the general public. So this is what I think the outcome of this whole month's exercise in the form of protocol. I would once again thanks to giving me this platform and sharing my views, and just listening to other learned participants or distinguished resource person. Thank you very much, Pavanji and Mohsin Sai.
Thank you, Mr. Ranjit sir. A very good brief you have given, what we should follow. I welcome Dr. Yunus Munshi, Research Director at RIM Hyderabad, British Ayush. He is also a pillar of World Unani Foundation as well as IRES. Welcome, Dr. Munshi.
Good evening, everybody. Namaskar, Sharmaji. Assalamu alaikum, everybody.
नमस्कार
Right from
नमस्कार
Dubai, Pakistan, Bangladesh, Sri Lanka, and our own India. Thank you very much for inviting me
दीदार
to
नहीं हो
this.
रहे हुजूर, आपके दीदार नहीं हो रहे.
Sir, thoda sa, do you know I am in Kashmir? And you know that
कोई बात
here it is very cold and we are hiding under the blankets.
अरे ग्रेट ग्रेट
So अभी 10
You are
डिग्री का
lucky.
टेम्परेचर है, तो 10 डिग्री में तो आपको मालूम ही है हम कैसे रहेंगे. So basically the theme today is Eid celebration, but as far as fasting is concerned, I have one study which was during my MD course, and as well as I had a project, dietary relations to arthritis. And almost every physician will agree with me that during fasting, most of the diseases get vanished. And that is a fact. There is a study from Oslo, Norway, where they have kept patients of rheumatoid arthritis on fasting for 15 days. It was not that fasting which we observe, but they were given only the juices. Then they were segregated in two groups. One group was given the vegan diet and another group was given the non-veg diet. And they then observed the recurrence of the symptoms. Same kind of study I went through during my project, which was submitted to CCRM, and it was in two phases. Only one phase was completed. That is, that we surveyed the patients of arthritis, osteoarthritis, rheumatoid arthritis, and gouty arthritis. Almost 300 patients were surveyed, and their dietary pattern was recorded. It was a 24-hour dietary recall, which is the pattern of the global pattern of dietary surveys. And we found that almost 80% of patients, because we have the almost 99% patients we get in the OPD in Kashmir, it is the Muslims. And during the fasting, 80% of patients said that they were not having any kind of symptoms during the fasting. So this is what the fasting has the effect. Although it might be having any medical effect, whether it is proven or not, but we observe the fasting because it is a religious obligation on us. और उसमें ये है कि आप भी देखते होंगे कि जो भी रिलीजियसली कोई चीज फॉलो की जाती है, उसमें ये नहीं देखा जाता है कि whether there are the benefits or not. Although always there are benefits. तो जो ईद का मामला है, बेसिकली जो फास्टिंग का कंसेप्ट है, it is that we should feel how the people suffer when they don't have food, when they don't have the drinking water, how they might be suffering during all these this month, during the month of fasting. We have to feel like that. And the celebration of Eid is a social obligation that you have to give fitrana, that is the charity, in cash, and it is almost 150 rupees per head. and it is to be given if a child is born just before the Eid. It is to be given to the poor so that they will celebrate the Eid with us. So there is a social obligation as well as a religious obligation. And then we give the charity more during the Ramzan, and then we go for the we feel more towards the religion. Whatever work we do, we keep in mind that we are fasting, so we have to do it very honestly. Although we do it honestly, but in these days we take most care of this. So as far as the medical concept is concerned, I already during the first week of Ramzan we are having the webinar where I told that almost all the religions have the fasting in one way or the other. There is the fasting in Hinduism, there is a fasting in Christianity, there is fasting in Judaism. Every religion is having fasting. Different people fast differently. In Hinduism, we have seen that uh, you can take juices, etc. You can take water during the fasting. In Christianity, they don't take suhoor, which is obligatory for us. That we have to take suhoor during the night. We have to take meals early in the. I think it is before the uh, Fajr prayers are called. So that is obligatory for the Muslims. While as I think in the Christianity, I don't know much. In Christianity and in Judaism, it is not important that you take the suhoor. So then, when dawn, when there is a time of dawn, we break our fast. But that 12 hours, that 15 hours, we see how we can tolerate the fasting. We can tolerate the thirst. We tolerate everything. So that is the concept of this fasting, that you should feel all these what the people go through when they don't have the food. And then on the Eid, you celebrate along with the people, along with your nears and dears, and you pay the charity, you pay the fitrana, so that they also get good clothes, they also get the good food on the eve of Eid. So this is one point of this fasting and Eid. And another point is that I already told you that I was searching for that paper which I have already published. I will just see if I'll get hold of that. I have already mentioned in that paper that has been published in PubMed Index journal. Just a moment. I'll see if I can get hold of that. It is dietary relations to the disease activity in arthritis. Please bear with me. So if you allow me, I can share the screen. Just a minute.
You can.
Sure, sir. So I think screen is visible. Is it visible?
Yes, yes.
So here you can see, I have highlighted this. I have highlighted it that in our study, 61.5% of RA patients out of 86.6% who observed fast got relief in the symptoms, but the symptoms recurred when the normal diet was reintroduced by them, thus agreeing with the earlier studies. There has been such a study conducted in osteoarthritis and the effect of fasting. But in rheumatoid arthritis, one study has been conducted. You can see it has been reported by various researchers that during Ramadan fasting, there is increase in certain blood constituents. In one such study, increase in high density lipoprotein, cholesterol was reported. Also, decrease in the body weight has been reported, which already Mohsin Saab told that he has lost almost 5 kgs of the weight. So, which can be responsible for the relief in the symptoms of osteoarthritis. Increased fat oxidation has been reported during Ramadan, which can also be held responsible for the decrease in disease activity. So, these are the references. So, it is not only the fasting, it is not only the religious obligation, but there are medical evidences also that fasting decreases the symptoms of arthritis. Not only arthritis, even I have seen the people. I have my colleagues in my National Research Institute of Unani Medicine who told that we don't take any kind of blood glucose lowering drug during Ramadan. So it has also blood glucose lowering effect. So non-communicable diseases can be managed with the fasting, and I think we should advise the patients to fast intermittently. जैसे अभी हमारे इदरीस साहब ने कहा कि there should be intermittent fasting. So intermittent fasting is very much healthy. If in a month you fast for 4 days, 5 days, it should be made as routine during every month. And that is all what I have for uh, uh, you this time. Thank you very much for giving me the chance to speak in this form, in this beautiful form. Thank you.
Thank you very much, Dr. Munshi, for a wonderful presentation on the effect of fasting on Ade. I would like to call Dr. Benazir Qureshi. She's a Unani practitioner, Cleopatra Spa and Wellness Center, Wafi Mall, uh, Dubai. Though she was busy, requested her to join us for just 5 minutes. So I just want to thank her. And yes, please, the stage is yours, Dr. Qureshi.
Good evening, everyone. Eid Mubarak to you all. Finally, the Eid came and the Ramadan finished. So we were enjoying Ramadan too much. Actually, in UAE, Ramadan has a very different ambience. Everybody, duty hours are less. Actually, in Ramadan, the duty hours go less. And thank you so much, Dr. Mohsen and Dr. Pankaj for inviting me. So would like to just share, I'm not talking much. I will just like to share something. I think you can hear me? You can hear me, right?
Yes.
Yeah. So I'm just trying to share how is the, how the ambience and how is the life in UAE when it comes to Ramadan. Usually what happens that during Ramadan, everything, the duty hours changes. And here it is more about tolerance. Anyway, when everybody was speaking just now, the two people which I heard before, that it is about, fasting is about being tolerant, being more patience, following a strict discipline, during the Ramadan hours, uh, abstaining from food and drink, which is the basic necessity. So this teaches us, like, think mostly it teaches us being, empathy towards the one who are less fortunate, to understand how they feel when they are hungry or without food and basic necessities like water and all. And also it is it's like we are obedient to the God. We are obedient to Allah and following his instruction and trying to do the fasting things. And it is like also teaches ourselves a self-discipline. So in UAE, the ambience is, it is not just only for the Muslims, but it is also for the other nationalities and also for the people who are non-Muslims. Even they enjoy the Ramadan. They go for the iftars, because there are a lot of iftar parties and these things happens even in the companies, and even the people do it separately. So they also get to know how it is, the feel of the this month, especially during Ramadan. And also what happens is that due to the duty hour, there's a big change in the life. That life absolutely changes. We go to the mosque usually here. Even for the Isha and Tarabi prayers, we go to the mosque. And not just that, we also go for the, in the last 10 days, we also go for the, what you call it, Qiyamul Layl, or the night prayers. We go for the night prayers as well into the mosque. So it is like from night 12:30 to 2 a.m. So that routines, that routine is a very different routine which we don't follow any time in the year. I mean, personally, people can follow it individually, but usually in a mass, like in a mass, we usually people don't follow, and it is really connecting. It is spiritually connecting, and it teaches us a lot of self-discipline, lot of tolerance. And also before, in UAE, what used to happen is that in Ramadan, there used to be no restaurants open in the daytime. It used to be open only in the night after the iftar. And nobody was allowed to eat in the daytime outside. But now they have become very tolerant. They have stopped all that. Now, anytime you can eat in the open even during a Ramadan. They said whoever wants to fast will fast, but whoever wants to eat and who don't follow this, they are open to eat or drink. And so it is like about being tolerant. And we also, like Muslim, as a Muslim, we are also being very tolerant here. And so, this is what I can understand, is that during Ramadan we teach ourselves being self-disciplined, being patient, being trying to understand how it feels when we are hungry. And then the scientific benefits, as Dr. Munshi was saying, that definitely there are a lot of scientific benefits behind the fasting. When we fast, definitely the body, the process of getting rid of that inflammation in the body happens because of the detoxification. We are detoxifying basically when we are fasting. So we are reducing the inflammation in the cells in the body, then the soft tissues. And this leads to a better well-being and better rejuvenating effect post Ramadan. So after this routine for a month, when we go back to our usual life after Eid, still we try to be, and we feel we are really very energetic. I myself, I feel really energetic. I'm sure everybody must be feeling the same. We really feel energetic because we have gone through a process of detox for a month, and which gives us a boost. Our immunity is boosted and our well-being is boosted. So I think this is all about it. And here in UAE, now we are back to normal after Eid. Eid holidays we have definitely for 4 days. And we enjoy during that time going out, outdoors, or, meeting friends, families. But then back to routine with lot of traffics, and schools are open now back to normal hours, because in Ramadan we had less working hours. Usually it is only 6 to 7 working hours. And that too, some places or even in the clinics, we operate only after Isha. So right, like 9 p.m. till 1 a.m. in the night we operate. Those are the timings where the people, they go out, and they, even in the clinics, I'm talking about me, even I used to work till late night. So now we are back to our normal routine, and I think it's fine. We are looking forward again for the next Ramadan to come, inshallah. So I'm wishing everybody again a lot of good wishes, and Eid Mubarak to you all. Thank you, Dr. Mohsin.
Thank you. Thank you, Dr. Bindu. Yes, it's really great to know that how you all celebrate Eid in UAE. Without wasting much time, I would like to invite Dr. Arman Zargaran. He has a flight to catch this, and despite that, he is ready to present something. He is the Vice Dean, School of Persian Medicine, Tehran University of Medical Sciences, Iran. Dr. Arman, thank you very much. Please, the stage is yours.
Assalamu alaikum. Thank you, dear Mohsen and all, and thank you for this, for organizing this very great and very nice meeting. As you know, in Iran, as an Islamic country, Ramadan is very important, and the Eid al-Fitr is one of our most important celebrations annually. In Iran, we have some kinds of Eids. Some of them are national celebrations, and some of them are Islamic celebrations and also religion celebrations. For example, Eid al-Nuruz or Iranian New Year celebration that it is started from 21 March, and this year it was alongside with Ramadan. It takes about 2 weeks in Iran, and we celebrate this historical Eid and celebration that dates back to more than 3,000 years ago. And another important Eid and celebration in Iran is Eid al-Fitr, and because this Eid is so important that it covers all branches of Islamic ideas and opinions, and it is respected for all Muslims all around the world. And in Iran, this Eid is so important. And as you know, one part of this importance is about its religious matters, and another part is because of its importance for health. And we know that our Hakims in the past, in Unani and Persian perspective, they worked greatly to advise us how we can make this Ramadan and this fasting beneficial for the health. Therefore, it's important for us in Iran that during the Ramadan, we try to teach people how they can take fasting and be fasting according to the traditional Persian medicine teachings to promote and improve their healthy life during this time. Because as you know, if we don't know how can we eat and drink in Sahar and in Iftar, fasting maybe harm our health. Therefore, it is too important for us as Persian medicine practitioners to teach the people how they should eat and drink in Sahar, and then how in Iftar, and how they can have good dietary regimens during the time between Iftar and Sahar, based on Persian and Unani medicine perspective and teachings. And also at the end of Ramadan, Eid al-Fitr is so important for us in Iran. There is 2 days holiday for this Eid, and it's very good opportunity for the people during this time to celebrate these great days after this great month, after fasting during Ramadan months. And it is as a important national celebration in Iran. And I have a suggestion. It is very good event, I think. But for next year, I think we can think about some webinars, international webinars, before Ramadan, to share our knowledge and experiences about our researches on fasting, and our Persian and Unani practitioners all around the world can join us online in the event and share our experiences and share our researches in the field. And also we can have some or one webinar for the public, at least for medical practitioners, for students, for other branches of medical practitioners, to teach them the teachings of Persian and Unani medicine perspectives and teachings in the field. And I think it can help our medical teams in India, in Iran, in UAE, in South Africa, and other countries that Unani and Persian medicine are practiced, to improve health conditions during Ramadan, and maybe we can, for example, call it as the perspective of Unani and Persian medicine teachings for healthy Ramadan or for healthy fasting in Ramadan. Maybe we are ready for such collaboration with all of you to organize such meetings. I think about 1 month or 2 weeks before starting Ramadan next year. Thank you very much.
Thank you, Dr. Arman. Yes, definitely. We'll make a note of this, and I will request Dr. Pawan Sharma to please hold one just a week, 10 days before Ramadan. Yes, this time we held it, but it was quite late. I would like to welcome Dr. Asrar Ahmed. He's currently in Brussels, and he has also joined us. He was just showing the view of
Hello,
Brussels.
everyone. Assalamu alaikum. Hello, everyone. I am here in
Welcome.
Ghent, in Belgium, and I celebrated my Eid celebrations over here in. I celebrated my Eid celebration over here in Brussels with my son and my niece and her husband, my son-in-law. So it's a very beautiful Eid over here. We perform our namaz in a well-managed place, which was managed by Moroccans and Algerians most of the time. And it's a very beautiful weather here. You can see, I can show you if you are watching me. It's a very beautiful place, Ghent. So from my side to all of you, very Eid Mubarak to all of you. आप सबको बहुत बहुत Eid Mubarak. जिन्होंने ऑर्गेनाइज किया उनको भी सभी जिम्मेदारान को मेरी तरफ से बहुत बहुत ईद की मुबारकबाद. Thank you.
Thank you very much, Dr. Asrar. Thank you for showing us the beautiful Brussels. I will now request Dr. Mujib Hussain, Coordinator, Unani Sim, School of Natural Medicine, Faculty of Community and Health Sciences, University of Western Cape, South Africa.
Assalamu alaikum. Can you hear me?
Yes, we can hear you. Yes.
Could I share the slides?
Sure.
After completion of session one, please guide me, Mochen White, to change the link on YouTube.
Just let me know if you can see the slides. Are you able to see the slides?
Not
Still buffering.
Okay.
okay. Okay.
Okay. Okay, Assalamu alaikum wa rahmatullahi wa barakatuh. I wish everyone a belated Eid Mubarak and hope you had a great Ramadan. I would just want to share some of our experiences in South Africa. We've been researching spiritual care for more than a decade, and we've been looking at all the activities of religion and spirituality, and we look at the effects that it has on holistic health. And this work is funded by the National Research Foundations of South Africa, and it's in collaboration with the late Professor Rashid Bika's Institute. It is based on his work, The Medicine of the Prophet, which is Tibba Nabawi, and it's also based on the medical ethics of Hippocrates, Galen, and Ibn Sina. So we find that spirituality and spiritual care today is a very hot topic in medical professions because it has profound effects on the overall wellness. And today it is recognized that it is a standard of holistic care. So if you claim to practice holistic medicine and there's no aspect of spiritual care, it means that your practice is not holistic. So just the basic definition of spirituality is the way that people seek to express their meaning and purpose in life, and the way they connect to each other, to themselves, to nature, and to a creator. And spiritual care in healthcare professions refers to those actions that the professional has to practice in order for patients to feel comfortable. So definitely it is an indicator of holistic care. And without a doubt, every nationality, every community around the world has a spiritual practice that they rely on.
because all human beings know that when we connected spiritually, we deal better with our physical ailments, with our mental challenges, and we deal better socially. So in South Africa, we've been looking at Mizaj, and we went deep into the text, and we found that there's an aspect that has been neglected in the profession globally, and that is the spiritual personality. So the spiritual personality connected to each element has certain peculiarities, certain characteristics. And we find that during the month of Ramadan, it creates an environment that allows people to be well internally. So it's not only the abstinence of food, it is the whole ritual that come with it, the religious obligation of charity. So scientific evidence show that when you hand over the piece of bread to the person that needs it, the chemistry that happen biochemically in your mind releases hormones that makes you feel content and happy, which contributes to your well-being. The spirit of giving, the spirit of praying, performing routine prayer, relying on your creator, removes all the anxiety that we have about worrying about our future. So what happens in Ramadan, it brings about a whole list of emotional, mental, psychological,
Sir, your
communal.
slides are not moving. Your slides are
Okay,
not moving.
sorry. Okay, I'm at this one now, the spiritual personality. So from
You
our studies,
please,
can you see it?
please go for slideshow to maximize the size of slide.
Okay. Do you see it?
Sir, you share the screen where the slides are available. You are sharing the screen where you have the PowerPoint presentation editable.
Just click on this slideshow.
Yeah, it's clicking at the bottom, yeah.
Unless you will not share that screen where that presentation is available.
Please share entire screen instead of a screen.
Yeah, okay. Share entire screen, yeah. Do you see it now?
No,
Not?
no.
Okay, let me try again. Yeah, see my screen sharing is not allowing. Okay, no problem. I will just speak about the slide. It's because I see I don't have the option to share anymore. Okay. So the studies that we've done is to notice that each mizaj, each element has some type of benefit that they find in Ramadan. So for the sanguine personality, the social interaction benefits them. So when they go to Salah and they meet each other and they spread the good word, it feeds their akhlaq, their good humor. And when they continue in their rituals, they find wellness. For the Balgham personality, water temperament, they're all about being the guardians of society, charity, in people's needs. So Ramadan is a time for them to explore that compassionate side. Then we find for the Safravi and the Saudavi, the bilious temperament, the fire temperament. Other times of the year, they struggle to control emotions like anger, irritability. But for some reason, in the Ramadan, the recitation of the Quran, the advices that we hear, somehow cools down the temperament. So definitely, we found that in the month of Ramadan, every temperament finds some type of wellness, some type of coolness. For the melancholic temperament, Ramadan is an excellent time for them to connect spiritually. And we find that they think very deep, they contemplate, they reflect, they write very well, they align to their spiritual selves on a higher level. So from the lessons that we have in South Africa is that the month of Ramadan presents way more than we can see from the outside. It's not mere only from the fasting, it's the entire month, the entire rituals, the entire routine. And the take home message is to practice as much as we can out of the month of Ramadan. So I thank you for the opportunity and I wish everybody a pleasant few months ahead. Jazakallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you. Thank you, Dr. Mujib. Now I would like to call Professor Ghazala Mullah. She's the principal ZVM Unani Medical College and Hospital, Pune. Dr. Ghazala, please.
Assalamu alaikum, everyone, and a very good evening. Thank you, Sharma ji, and thank you, Mohsin Saab, always letting me a part of this exclusive gathering. So, first of all, Eid Mubarak to you all. And as all senior people, they have expressed different aspects of fasting. Here, I would like to highlight about the spiritual point of view of fasting. So, when we talk about health, so WHO, they have included spiritual health also in the definition of health. So, why the spiritual health is very important? Nowadays, as we know, the mental issues or mental health issues are on rise in post-COVID era. So we can have two types of now era, pre-COVID and post-COVID. So when we talk about in the post-COVID era, mental health issues are more on rise. So, and one of the, you can say, cause of or the effect of mental health issues are overthinking, stress, and that may lead to overeating also. So the fasting, it helps us in self-restraint and patience. So when we are having self-restraint and patience, we can control our anger, we can control our negativity, and we can think of more in a positive way. And then the spiritual well-being, it also promotes the inner peace. So in Unani system of medicine, we always say tabiyat mudabbarai badan ya tabiyat. और मोस्ट ऑफ द टाइम हम कुछ लोग जो है हमेशा ये कहते हैं कि मुझे अच्छा फील नहीं हो रहा, या मेरा जी अच्छा नहीं है, या मेरी तबीयत अच्छी नहीं है, या मुझे अच्छा नहीं लग रहा. Even though if we look at their, you can say, investigating report, the most of the time their reports are normal, but even though the person says that I'm not feeling good, I'm not feeling well, और ये कहते हैं कि मेरी तबीयत अच्छी नहीं लग रही, या मेरा जी अच्छा नहीं है. So that tabiyat is very important. So when a person is at peace, or if the person is having inner peace, so the fasting, it promotes the inner peace, and it also guides us towards ethical decision making. So when we, you can say, follow the all the spiritual aspect or religiously, then the whole year, the rest of the year, we can, the spiritual well-being can also guide us for ethical decision making. And it also promotes our moral behavior through spiritual principles and the values. So when we are looking at the fasting more at a, you can say, scientific way, we can also, you can say, analyze the, you can say, fasting in spiritual aspect of the fasting. So this is what I think that, of course, it has got the, you can say, physical benefit. It has got the other benefit, social benefit. But if we, you can say, elevate ourselves at a spiritual level, then definitely our social commitment will also change. So when a person is true to it, you can say spiritually, then definitely all his behavior, all his, you can say, social connect, personal decision, interpersonal relationship will improve. And definitely then it will benefit to the society as a whole. So this was, you can say, my looking at the fasting. Thank you. Thank you very much.
Thank you, Professor Ghazala Mullah. Now I would like to invite a young doctor, Dr. Arif Khan Guran. He's the Assistant Professor, Department of Swasthya, ITRA, Jamnagar.
Assalamu alaikum, sir. I humble request, can I deliver my lecture in last, please?
Okay.
If any other.
Okay. We'll shift now the Dr. Shaunak
Welcome,
will now.
welcome, Arif. Welcome.
Thank you, sir.
Can we change because the first session is over?
नहीं, आरिफ क्या बोला?
He'll speak in the end.
Next session.
Yes, please.
So please conclude this session, Mohsin
I
bhai.
thank all the speakers, and I would request them if they can stay for the next session. We have wonderful speakers in the next session as well. Thank you very much. We just